GERD, or which is also known as the gastroesophageal reflux disease or the phenomena, is one of the major causative factors for the development of the abdominal pain. So when we look into the details, we must know that what would be the particular clinical picture when we have these patients of GERD. They would be suffering from heartburn, which is one of the major associated symptoms. Regurgitation or reflux phenomena is one of the is one of the major symptomatology in these particular patients. Belching or bloatment, all of these would be associated with the phenomena of GERD. Then these patients would be also suffering from dysphagia. That is basically the difficulty in the swallowing. This is termed as dysphagia for these patients, and they would be suffering from it, and they would be complaining of this particular phenomenon as well. And an array of extraesophageal symptoms as well, weight loss, then again, the easy irritability, anxiety, all of these features would be present in the patient as well. The management of the gastroesophageal reflux disease, it is basically dependent upon the medical history. A catheter or wireless pH metry is done for the patients, impedance of the pH monitoring, and then you look for the endoscopy to rule out any other causes, any other life-threatening causes that are responsible for GERD. So all of these phenomena or all of these investigative techniques can be resorted to in these patients. We usually ask for a lifestyle modification in these patients, and usually a complete lifestyle modification is required. Exercise is usually advised for. The modification of the diet is very important. Intake of more fiber is also prescribed to these particular patients. Antacids are usually coupled up along with this particular lifestyle modification. And the drugs of choice in this particular case are the simethicone, we have the H2 blockers, and we have the proton pump inhibitors or PPIs that can be basically prescribed to these patients as well. Prokinetic agents, obviously, we want to basically relieve the symptoms of constipation, and that is again going to be inhibitive of the GERD phenomena or the reflux phenomena that the patient is suffering from.